My name is Juan Villacres and I'm going to talk about the Aliskiren and Enalapril in heart failure. What is a heart? A heart failure is a condition in which the heart can pump enough blood to meet the body's needs. Common causes of heart failure are coronary artery disease, high blood pressure, and diabetes. It is more common in people who are 65 years old or older, African American, people who are overweight, and people who have had a heart attack. Men have a higher rate of heart failure than women. The angiotensin converting enzyme inhibitors are effective in lowering the risk of death and hospitalization among patients with chronic heart failure and reduce the jet fraction. As a consequence, there has been interest in other approaches to interruption of the renin-angiotensin systems in patients with heart failure. Angiotensin receptor blockers were the first alternative tested. In a placebo-controlled trial, the candesartan was associated with lower risk of death from cardiovascular causes and hospitalization for heart failure among with patients who could not take ACE inhibitors. However, in a head-to-head comparison, losartan was not as effective as captopril. How do the ACE inhibitors help? The ACE inhibitors help the arteries to relax. This lowers blood pressure and reduces the amount of work that the heart has to do. They can be used alone, but often they are used along with another drugs, such as diuretics, beta blockers, calcium channel blockers, and ARBs. The Aliskiren. The Aliskiren is a direct renin inhibitor. It is approved as an antihypertensive agent, but there are concerns about its use with angiotensin converting enzyme inhibitors or angiotensin receptor blockers, particularly in patients with renal impairment. In the Aliskiren trial to minimize outcomes in patients with heart failure, an industry-sponsored study with 7,000 patients who had chronic heart failure were randomized. After avoiding fees to treatment with Aliskiren, Enalapril, or a combination of both drugs, this trial fails to show that the addition of Aliskiren to Enalapril reduced the risk of adverse outcomes in patients with heart failure. Moreover, the Aliskiren alone was not better than the Enalapril. In conclusion, in patients with chronic heart failure, the addition of aliskiren to enalapril led to more adverse events without an increase in benefit. No inferiority was not shown for aliskiren as compared with enalapril.